Welcome to the PT Walkabout podcast, a podcast that serves to inspire and inform listeners about physical therapy. My name is Dr. Lynn Steffe, and I'm a PT business and marketing consultant, best known for traveling the country both in person and virtually to help kick off, improve, and grow businesses. I wanted to share the gift of incredible insight to vital issues in physical therapy from interesting colleagues nationwide. We will explore the business of physical therapy, the role of physical therapy in lifestyle medicine, and actually all things physical therapy in order to help you grow your business. This podcast is offered through the generous support of our sponsor, alinea-engage. Alinea is on the forefront of digitizing your patient intake and driving loyalty before your patients even walk in the door. So this is Lynn Steffe, and I'm on a PT Walkabout, and my walkabout's all about the journey, and the best journeys answer questions that in the beginning you didn't even think to ask. So today, because I'm in La Crosse, Wisconsin, at the Wisconsin Physical Therapy Association Spring Conference, I have the privilege of interviewing a PT who is a friend and a mentor and truly a leader in terms of physical therapy in Wisconsin, very involved with FSBPT and our credentialing, etc. And so I have a couple questions I thought I'd take the opportunity to ask her. But Michele Thorman, please tell us just a little bit about yourself first.
Thank you, Lynn. My name is Michele Thorman. I've been a physical therapist for about 41 years and have been practicing in the Milwaukee and La Crosse areas. I currently am on faculty at the University of Wisconsin-La Crosse, where I serve as a associate program director and faculty member.
Okay, awesome. And so how long have you been with the UWL program?
17 years. I came as a clinical director of clinical education and progressed to a program director out of default and needs for the program.
That's awesome. And they're so lucky to have you because I know how passionate you are about students. So having been in that role or some variation of it at the university for 17 years, what kinds of changes have you seen in the students over 17 years? And what should people out in practice look for from the new professionals coming out? Kind of two questions. So start off perhaps with what kind of changes you've seen.
Well, I think about going all the way back to when I was a student and you and I were students, Lynn, and the culture and how we were raised was very subservient. We were taught to not question authority that much. We were taught to give immediate respect to our educators and do our best and not challenge a whole lot, but just do our best to take in as much information as we can. I think today's learner is quite different based on, again, the way that we've raised them. And the fact that they're very, very bright students, they've had very successful academic careers. Their expectations of faculty are very high. I think at times their need for maybe more feedback than we would expect and more positive feedback than we would expect is probably very high too. They're extremely ambitious, they're extremely competitive, and sometimes we have to kind of mute that down once they're accepted into the program and understand that they're not learning necessarily for the sake of getting a good grade. They're learning for the sake of their patients that are waiting for them in their future and to learn for the sake of applying what they're learning. I will say that the students today, our learners today, are incredibly giving in terms of their volunteer time. That's a part of the fabric of their souls, and I think that brings a real dimension to who they are as people and who they'll be as professionals.
So that's awesome. I have the privilege of guest lecturing at a couple universities, including UWL.
And you're great.
And I totally enjoy it. I feel that the students are so incredibly bright and they're very resourceful. They're great at looking things up, but they do have a little bit of a critical eye or ear for how you teach. And they're probably a little bit more willing to give you feedback on that than we were back in the day for sure. But okay, so with that in mind, if you were hiring new grads or new professionals, which I would consider students that are out the first 3 to 5 years, what kinds of things do you think they particularly bring to the table that are really positive that people should look to leverage? And the flip side of that, are there challenges that you have to almost kind of prepare yourself for um, to really make the most of those new hires?
Good question. Um, Clearly, I think we're graduating students that have an enormous amount of contemporary information, certainly cutting edge ability to access research, to apply research, to know the best outcome measures, all of the head skills that we would expect. I'm hoping that some of their hand skills are developing, and certainly we wouldn't let them graduate if they didn't meet some minimal competencies in terms of their psychomotor skills. I I believe that the new graduate is going to have a strong value for balance. I think they're going to have a strong value for purpose. So the clinical environment in which they work needs to match some of their own personal values or social justice values or meeting the needs of underserved. Those are things that are going to motivate this particular new employee. And at times, I think the balance thing is a little bit of a challenge, especially in an intergenerational workplace where boomers like us, will do whatever it takes to get the job done and stay as long as we need to. I think our current students are maybe a little more discriminative about how much of that they choose to do while keeping their work-life balance healthy. I'm not sure which one is best. I do think it probably creates some tensions in the workplace.
Well, it's so interesting that you say that because I often look at them and I think, wow, we have stuff to learn because I think of the long days I put in sometimes, and I'm not always sure it was the right thing at all points in my life. And sometimes I look at their core value system with that, and I think it's really good. But I will tell you, and I always tell students this when I have an opportunity to counsel them on career planning and on interviewing, I tell them not to use the word balance because that whole career life balance, that concept makes baby boomers crazy. It's almost like it's a negative thing. It's almost like they interpret it as I don't want to work. So I try to encourage them to use different terminology. I try to say, what are the needs of the clinic or the practice or the facility? And I wonder if we could explore flexibility. I try to encourage them to propose different ideas. So if someone says, well, it's, 10 to 6 these days of the week, and just say, I really think that I could do that these days. I wonder if I could instead have Wednesday mornings off, or, I could flex to do this. But I try to get them to use the term flexibility and get away from that balance word for whatever reason. When they use that word, the shackles on the back of the
Right.
neck of the average hiring
Right.
PT
Right.
go up, and it's really hard.
Yeah.
What are your thoughts on that?
Well, I think that's good advice to any new graduate. I will say that one of the challenges of educating this learner is meeting them where they're at, and yet knowing that they have to be at a different place before they can enter practice and be successful. So overcoming the resistance of I want to create my own path, or I want to create that so-called balance, but knowing that in the clinic, patients don't come at regular schedules.
Yeah.
Patients have um, issues at any time of the day and night. Admissions come in the hospital settings, and there's no control over that flow. So you get the needs of the workplace done. So in our program, we have professional values that run in our veins, and I know the students get tired of harping on it, but that's part of helping them get to the place where they are as individuals and how they've been raised to be kind of entitled, and then reaching a new professional shelf where the needs of a clinic, the needs of an organization, the needs of patients are routinely met, and it's part of the culture of their practice, it's part of the culture of the organization that they must work for.
Yeah, and I think that that's important. I mean, that sounds like you're doing a good job of introducing that, and it's really as an employer's job. So, as much as I just suggested to you that it's important to say that to students about the whole balance thing, I also say to people who are hiring and interviewing new grads and young professionals, I try to say, don't go crazy and just expect them to have the same work like rigidity that you did. That we have to learn too, that generation of boomers has to learn how to flex too. And I do feel that that value of flexibility can make up for a lot of things. Talking to young professionals and people of my vintage, which is the word I love to use for age, is that flexibility in life is such a high value thing. And when we balance that with the needs of the people we're trying to serve, I think we can come to agreement. So I think both parties have to give a little bit. And that whole idea of compromise is, it's very professional. It's professional to take a step back and say, what are the needs of the consumer? What are the needs of the facility I'm serving? So I think that's a possibility. So wonderful insight, and I just think you have been such an incredible leader in education, and so I really appreciate you sharing that with me.
Well, and Lynn, thank you for your support of our students and all students and everything you've done. It's been a privilege.
All right, thanks so much, Michele. Thank you so much for listening to this week's episode of the PT Walkabout. Be sure to subscribe and share our podcast with your colleagues. We look forward to offering more great information to inspire you on the next episode of PT Walkabout.